22 proposals were attached to
You're missing a name?
You're missing a name on the list? I don't know, I only need 16. Could be some. Could be- No, everyone really wants to. Oh.
Asian Family Services has a public service and instruction.
Okay, okay. All right, good. Okay, thank you. Well, we just saved, 12 minutes. Good evening. Welcome to the meeting of the Skokie Village Board for the new year. 2021 will be a better year. Couldn't be any worse, that is for sure. This evening, we are at Monday, January the 4th, 2021. Before commencing the meeting with the Pledge of Allegiance, I would like to read a notice which we have been using at every village board meeting during the COVID crisis. Until further notice, meetings of the Skokie Village Board will be held electronically, with a majority of village officials participating via remote access in order to comply with the State of Illinois Gubernatorial Disaster Proclamation. Members of the public who wish to comment on an item on the published agenda or to comment during public comments must submit their statement or question in writing to the village manager's office, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may be submitted by email to citizencomments@skokie.org or by mail to the Village of Skokie Village Manager's Office, 5127 Oakton Street, Skokie 60077, or alternatively, via the village's Dropbox located just outside by the public entry to Village Hall. And now, we will be led in the Pledge of Allegiance by Village Clerk Pramod Shaw.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The meeting will come to order, and the clerk will please call the roll.
Trustee Roberts,
Here.
Trustee Sutker,
Here.
Trustee Ulrich,
Here.
Trustee Bromberg,
Here.
Trustee Klein,
Here.
Trustee Gray Keeler,
Here.
Mayor Van Dusen.
Here, we have a quorum. Next item on the agenda is approval of the consent agenda for this evening's meeting. A motion is in order. Trustee Klein, seconded by Trustee Bromberg. Is there anything on the consent agenda anybody would like to have removed? If not, call the roll,
Trustee
please.
Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes. Next item is report of our village manager, John Lockerbie.
Thank you, Mayor Van Dusen, and good evening, everyone. Item A this evening is regarding a COVID-19 update, and Mike Charlie, our Director of Health and Human Services, is with us this evening to discuss the most up-to-date information.
So first of all, I want to thank Mayor Van Dusen and the rest of the board for providing me an opportunity to provide a COVID-19 update on behalf of the Health and Human Services Department. Tonight, I have a few things that I'd like to update the board on, including providing some brief Skokie COVID-19 data, an update on the COVID-19 vaccine, and an update on the village's point-of dispensing planning or clinic planning. So data-wise, so the village of Skokie has 4,483 resident COVID-19 cases that have been confirmed through yesterday. Total deaths being 97. Our average cases per day is currently at 24 cases a day, which may seem bad, but back in November, we were actually up at about 60 cases per day. If you do take a look at this chart, you can see that this chart that runs from October 1st through December 30th or through the beginning of January, you'll see that we saw a significant spike in cases, from mid-October through November. And then the governor had shut down the state, right? And I think that made a significant difference in our numbers locally. And if you were to look at the state's chart, you would see the same. So the good news is we're heading in the right direction. And I'm hoping that people, not only in Skokie, but throughout the country, continue to follow simple COVID rules, things like social distancing, washing your hands, not congregating in large groups. Certainly, I think that during the holidays, I'm sure that Skokie residents did their part. The last 7-day moving average positivity rate that we have on our website is a little bit old. We do get daily reports from the state. That's why I want to make it clear on this slide. It says the unofficial 7-day moving average. This number I'm giving to the group is an aggregate data amount that hasn't been scrubbed. So, but I'd rather give this than give nothing at all. We certainly have gone down quite a bit over the last couple weeks. We were up at about 15% positivity rate when we were seeing those larger numbers. So some more good news is that our positivity rate appears to be decreasing currently. This is just another chart. The chart prior to that, I was showing just October 1st through today. This is sort of a representation of our numbers since our first case back in March to show you sort of that significant spike in cases that we saw in October and November. I did want to mention that we continue to do contact tracing. I mean, for the most part, it's 7 days a week. We continue to, every case that we do receive, COVID-19 case, we do follow up not only with the case itself, but also we identify close contacts and reach out to them. And we are ensuring as much as possible that our cases are isolating for the required 10 days and that the close contacts are quarantining for 14 days. In addition to that, we provide a ton of education and consultation to long-term cares, to our schools. We meet routinely with them and we field questions every day from those different organizations and groups in the village. As a Health and Human Services Department, we play a really important role in helping our local organizations be as successful as possible during the pandemic. Oops, sorry. Now I want to provide a vaccine update. I think everyone has been asking information about how soon can we get the vaccine. So I hope that this information provides what we know at this point in time. Things are changing every day, and we're making a lot of assumptions right now with the information we have available to us. So what do we know? We know the vaccination is going to take place over many months. This isn't a sprint, it's a marathon. Vaccine will require 2 doses, of course, the two approved vaccines, the Pfizer vaccine at 21 days apart, the Moderna vaccine at 28 days apart. Vaccine supply is currently limited. It's not unlimited, right? So we are receiving small amount of a vaccine so far, and I'll go into that on the next page as to how much we've received and what we've done with that vaccine. But we do know that the vaccine supply is projected to increase quickly, allowing vaccination efforts to be expanded to include critical populations and the general public. And we've been planning for several months in order to prepare to administer a vaccine to those critical first responders, healthcare workers, and residents of the village of Skokie. This is just a picture I took. I had to crop out my hand over there because my fingers are not that pretty. But if you look on the left, that's just what it looks like when we receive the Moderna vaccine. It comes in 10 vials to a package. That 10 vials will provide 100 doses. So what you're seeing on the left is 100 doses of Moderna vaccine. On the right-hand side is just what the vial looks like. So a little bit of information more specific and down to the ground level on Skokie. We received our first shipment of Pfizer vaccine on December 17th and the second shipment on December 22nd. Now, when I say we received, all vaccine that is sent out to the village of Skokie is sent through the health department, but these the first two shipments actually got shipped directly to the North Shore University Health System. They actually got sent directly to Evanston Hospital, but because it's a hospital system, what they did with our vaccine is they've administered vaccine to all the frontline healthcare workers at Skokie Hospital. That was if you look at the priority list, they were priority numero uno, number one, and that's what occurred. We have started receiving and have received Moderna vaccine. We received 500 doses on December 28th, and we received 800 doses today. Our plan with the vaccine we're receiving, the Moderna vaccine, is to start vaccinating Skokie's population, organizations, and groups in phases. We have so far vaccinated Health and Human Services staff. We have vaccinated our first responders, our EMS, and we've also vaccinated some police department staff and our public works staff, a small number. We also plan on having a larger closed pod that's not open to the public to continue to vaccinate our staff tomorrow, where we'll be vaccinating approximately 120 staff. It's really important, and I think sometimes people may say, well, why are you a priority? Why is staff a priority over a general resident? Well, we want to make sure that the staff that's working these larger open point of dispensing or clinics are vaccinated to keep them safe, right? Because if we had staff going down at our pods, at our point of dispensing operation, we're not going to be able to vaccinate. So all the people we're vaccinating now are going to be actually working at our closed and open pods. Like I said before, the Illinois Department of Public Health and really all around the country, they've established this, what's called a phased approach to ensure that initial vaccination efforts focus on reaching critical populations first. We know that people over the age of 75 are more at risk. We know people who are obese, who have heart disease, who have cancer. They're just more at risk of when they do get COVID-19 having negative effect, death. So we're trying to reach those populations first. So I'd like to go over those phases really quickly. So what is phase one? Phase one is limited and scarce supply of COVID-19 vaccine are available. It's what we're experiencing today. It's not unlimited. Here are some of the groups. Long-term care facility residents. It started. We again, this is something that the Health and Human Services Department did, is we registered all 6 of our long-term cares and about 30 group homes with the states and the federal system where Walgreens is physically visiting those locations and vaccinating staff and residents. Village staff, EMS and police, we started vaccinating on December 28th. We also will be vaccinating Medical Reserve Corps volunteers that will be working our pod tomorrow. We'll be vaccinating our student. We have an agreement with the Oakton Community College where their student nurses will be helping us vaccinate. They will be coming in on Tuesday, January 12th. Healthcare personnel in hospital and non-hospital settings, so like our federally qualified health center, we've actually already provided them vaccine. Some of our vaccine allotment, private medical providers. So I'd like to talk a little bit about this. I hope I'm not going too deep in the weeds, and if I am, John will look at me and kind of nod me off. But we've been working for the past month or two on communicating with the providers, our healthcare providers we're aware of via email and phone, and communicating to them that they are within the first priority group. And what we need from them is how many, and these healthcare personnel we're primarily dealing with are non-affiliated primary care providers. So if you're affiliated with a healthcare system or a hospital, you should be getting your vaccination through them. But we have over 1,000 healthcare personnel currently that have we have quite a few healthcare providers that have responded. Over 1,000 of their employees need the vaccine. We also have reached out so we know through a survey which ones need it. It's just a question of when we have sufficient quantities available. We will be scheduling a closed pod, not open to the public, but open to them to get them vaccinated as soon as we can. We also have other congregate care facilities such as residential group homes. We have 30 of those registered with Walgreens to get their vaccine. So within phase 1, there's also a phase 1B. And if you look at this now, I am providing some timelines. And we're using certain assumptions by providing these timelines. So these timelines, I want to put a big caveat saying they are not set in stone. You know, we don't know if we're going to have sufficient vaccine necessarily to vaccinate according to these timelines. We're guessing at this point. The state does not come out and say you're getting this much vaccine on this date, this much vaccine on this side. I know right now we have 800 doses we received today and 500 doses we received last week. I have no idea exactly how many doses we're going to receive moving forward, but this is assumptions we're making. I want to make that clear. So persons aged 75 and older, frontline essential workers such as educators, daycare workers, postal service workers, and this is directly from the COVID-19 vaccination plan, which anyone can find online. These are the phased groups. We anticipate sometime in February and March starting to vaccinate those individuals. Phase 1C, persons 16 to 59 with medical conditions, or persons 65 to 74, other essential workers, February or March, okay? This is just a picture this is some of our fire department staff and getting vaccinated last week. This was some fire department personnel and some health and human services personnel doing this. I want to send a big shout out to the fire department for doing such a great job, and their paramedics will be helping us with the open and larger closed pods, and they're an essential part of our operation. So I've gotten through phase 1, now let's hit phase 2. The rest of the population, age 16 and up, is what they said. So we're thinking maybe late March to do this. By that time, we're going to have all of our staff fully vaccinated, and I'll feel a lot safer having our staff work these clinics where we have upwards of 1,500 people walking through in a single day, having 15 lines of vaccinating service. You're talking a lot of people, and I actually have an org chart I'll show you in a second just to kind of give you the scope of how large this operation could potentially be. So anyway, let's talk about the vaccination clinic itself. We call it point of dispensing clinic or a pod. The village has been meeting with both internal and external stakeholders for several months. John can attest to this, that we've been meeting with the fire, police, park district, and other groups in order to plan out a larger pod. Where will our larger pod be located? Well, and I also throw out our village corporate counsel, Michael Large. He's helped out quite a bit with this too. But it'll be at Erie Crown Hebrew Day School at 7770 Frontage Road. It's a great space. It's like the future space for that school. But they've been nice enough to allow us to use a larger room and several other rooms at that location. And I will be showing you a picture of that in a second. But I did want to go over a couple things since I have it on the slide. But how will people register to be vaccinated? Well, the state has a system called EM-Track. In EM-Track, I got my first presentation on EM-Track between 4 and 5:30 p.m. today. I have as many questions about that system as I have answers. But we're going to dive deep into that system over the next couple days to figure it out. But essentially, people will be, of the village of Skokie residents will be giving a link. And that link, based upon their eligibility and what phase they belong in, they will be allowed to register for our open pods or closed pods. If it's a closed pod, I know this gets confusing, but if you're a healthcare worker, we'll probably send a link out with a password, they'll get in. If it's open to the public, we'll be posting this information on the village website, via e-news, and any means possible we can get the information out to the public when those clinics are available to register for. When will the registration process open for the general public? Soon. I don't have a time at this point. I can't give you a definite time. We have to first figure out how EM-Track works and when we think we'll have sufficient vaccine to open up a larger pod. This is just an outside picture of the Erie Crown Hebrew Day School. This is sort of a map as to where it is. I circled where I think Village Hall is. Did I get it right? Close enough. But that's sort of where it is. It's sort of off to it by itself. It's a really great location with a huge parking lot. So I think it's going to be a good location for what we want to do. I did want to talk about what is the process from registration to vaccination. I think the public may want to know about this. The trustees may be interested in this, but so we'll notify everyone again via e-news, the village website. However, Ann Tennis is very good, our communications director, on pushing information out. Residents will register using EM-Track. So they'll go in and essentially what it'll show them is the dates and times available for them to register. You can register your entire family or your spouse or significant other at the same time. So it can be one person registering that other person. At the clinic, people will come into the clinic over at the Hebrew Day School. And what they'll do is they'll walk through and we'll have a registration desk. Actually, I could probably even, there's a better picture. This is a picture of sort of, by the way, this is Mike Charlie's graphics. I do apologize. This is an architect, but essentially people are going to be walking in. There's going to be a check-in. They'll get past check-in. We'll check their IDs, make sure they're Skokie residents, make sure they're registered, make sure they're healthcare workers, et cetera, if they qualify. Then they'll go into a staging area. Now, that staging area, we hope that there's 0 people in that staging area. That's our goal. We hope that they go directly from check-in to the vaccinators. We can have anywhere from 5 lines of service to 15 lines of service. It really depends on how many people we have available to run the pod and how many vaccinations we have to give that day. After vaccinating, then people will go into monitoring. People have to, after they get vaccinated, they have to wait at least 15 minutes at the pod or at the clinic to make sure they don't have any adverse effects. We're going to have a ton of personnel there. We're going to have our paramedics there. We're going to have qualified, we're going to have physicians there. We're going to have pharmacists there. We're going to have nurses there. This is going to be a huge operation. And after monitoring, if they feel okay, they are welcome to leave. If they have any adverse effects, they can always report us to us, and then we report it through a system called VAERS to the state. This is sort of an idea. If you can read that slide, you've got better eyes than I can. I do. But this is sort of, this is the pod operation if we were running full swing. You can see how many staff we have, so it's going to be all hands on deck. So far, I felt like that all village departments including John Lockerbie and his staff, have been very accommodating to us and been great in the process. Again, we're going to be using Medical Reserve Corps volunteers, the fire department, and others in order to make this as successful as we possibly can. With that being said, the last thing, until people are vaccinated, we do ask that people continue to wear a mask, watch your distance, and wash your hands. I think we're doing a great job, and I think we got to keep that up until we can get everyone vaccinated, and hopefully this vaccine will get us back to our day-to-day life. And maybe a year from now, I won't have to wear this silly yellow mask in front of the group, right? So, and I'm more, outside of that, I'm more than happy to answer any trustee questions.
Thank you, Mike.
You're welcome.
Trustee Klein?
Yes, thank you for the update. I just have a couple of quick questions. You said you received 1,300 doses of Moderna. Have you received any of the Pfizer?
Yeah, well, we have, and I think I skipped that in that one slide, I apologize. But 1,800 doses of Pfizer were sent directly to Evanston Hospital, and that's part of the North Shore Health System, University Health System, and then Skokie hospital staff then were vaccinated through those doses of Pfizer. So at this point, I think that we're going to be primarily administering Moderna through the health department, and Pfizer will be going to healthcare providers in the hospital system.
One more quick question. Of the 1,300 Moderna, have you dispensed them all?
Wow.
And what about the second shot?
Yeah, that's a good question. So the plan at this point is that through tomorrow, we would have administered our first allotment. The 800 doses then, we're planning on opening a clinic next week on Tuesday, a closed clinic to start administering vaccine to our student nurses and some of the other essential personnel that will be working the pod. And we'll also be using some of those to try to start to get to our medical providers that are unaffiliated with the hospital. I mean, our goal is to not stockpile this stuff. We do not want this stuff sitting in our refrigerator or a freezer. We want to open our pods as soon as possible. I will say there are some logistical things we have to work on, such as just getting the EM track scheduling system presentation for the first time today that we have to work out before I think we'll feel comfortable opening up some of the larger pods and getting this vaccine out to the public.
Thank you.
Trustee Sutker?
Thank you very much for the presentation, Mike. So my question is, I just want to make sure that I understand this correctly. After somebody is vaccinated one time and then a second time and then you wait a week, they're protected. But if they are 1A worker and they go back to their families, they can still carry the virus. Is that correct? That's what I heard on.
Yeah, so what we know is that, after that first dose, obviously, I think your body will start to build some level of antibody against the disease. At least there's a significant chance, 95% chance that you'll start. But you can still transmit it. Even after the second dose, since it's only 95% effective, there's a 5% chance that you're still a carrier and that you're still infectious. Obviously the hope is 9.5 times out of 10, you're not going to be able to carry the virus at a viral load that's going to transmit it, but there's always that small risk. So I think that until you see the numbers in regards to the number of actual COVID cases decrease to a certain level, the state's not going to retract the requirement for the social distancing, the number of people they can gather, the mask usage, et cetera.
And then my second question is, are they working on a vaccine for kids under 16, or is that going to be way down the road?
Yeah. You know what? That's what they're doing right now. I mean, that initial study they did on persons, they just didn't have sufficient numbers of pregnant women, and at least for Moderna, it was anyone under 18, and for Pfizer, it was anyone under 16. So yeah, that's what they're doing now. I mean, I know their goal is to get emergency use authorization for people under 18 or 16 as soon as possible.
Okay, thank you very much.
You're welcome.
Trustee Gray Keeler.
Thank you for the presentation. That was very thorough. I want to commend your department. I was contacted by a resident in December who was amazed at how quickly she was diagnosed with COVID. And she was just amazed at how quickly she was contacted by the health department and how professional the department was. So I just want to pass that on to you.
Thanks. Thanks. And maybe this is a good opportunity to just give a huge thanks to everyone working downstairs. I can speak on behalf of myself that it's like go down there. I'm not, and trust me, I mean, we want to do a great job for the village and we want to work as hard as we can, but there's a lot of frantic craziness down there right now. And everyone's working really hard and really cares a lot about this village. So I just wanted a huge shout out to the Health and Human Services staff and really the rest of the village staff that are going to be assisting us.
This community, but throughout the entire area, owe a deep debt of gratitude. Going back to the very beginning, I've told this story before, but your predecessor and others working in the health department warned us a year ago that what has happened was a possibility. And I come in on Saturday mornings, and it is not unusual to see people in the lobby who are with the Reserve Corps. Not this last Saturday, but the Saturday before, I was leaving, and there were a couple women out in the hallway, and I asked them if I could help them. I wasn't sure how they got in the building and why, and they said, well, I'm with the Reserve Corps, and I've been here for 5 hours already. Mike, everything that you've been doing is phenomenal, and it is exactly as you describe it. But it is not, I don't think, chaotic. It's organized.
Yeah.
And it has to do with the professionalism of the staff that we have recruited over the years, including yourself. That was a wonderful presentation. And I think it gives us a store of knowledge that we can share with the members of the community and give them confidence that we have a good idea of where we are going. But the one thing I would ask for anybody who is tuning in tonight or may see us subsequently, be patient. We don't know with certainty how much vaccination dosage we're going to be getting. It's dependent not just on manufacturing, but the whole supply chain, beginning with the CDC and the Illinois Department of Public Health. But I do want to thank you, and I want to thank John as well for all of the work that you've done. I think I speak for the entire village board and the entire group of citizens in Skokie. Thank you very much.
Well, thank you. Appreciate that.
We are
That
appreciative.
means a lot.
Thank you.
No, for some reason, the light doesn't work. Next, I'm sorry, John, beg your pardon.
That completes our report this evening. Thank you very much.
Next item on the agenda is report of our Corporation Counsel, Michael Lorge.
Thank you, Mayor, trustees. Good evening, everyone. My report contains one item tonight, and that is a request for executive session in accordance with paragraph 2C11 of the Illinois Open Meetings Act pertaining to new and other review and discussion of pending litigation. Mayor, I'd ask board action.
Thank you. A request for an executive session is requested. A motion is in order. Trustee Roberts, seconded by Trustee Gray Keeler. Call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye. The motion passes.
Thank you. That would conclude my report for this meeting.
The next item on our agenda is the 2021-2022 CDBG Public Hearing Number 2, Carrie Haberstich. Good evening, Carrie.
Good evening. Just wanted to kick off our second public hearing to prepare for the Community Development Block Grant programming for the upcoming year starting on May 1st. We'll call that program year 21. The first hearing held on December 21st reviewed the progress of the current year's projects and the overall objectives of the CDBG program. And tonight's hearing will involve a brief review of village proposals for next year, but is primarily intended to give representatives of community organizations the opportunity to present their requests directly to the board. The board has received a memorandum and overview of the funding requests along with copies of the proposals. The next hearing will be conducted on Monday, February 1st, when budget recommendations will be presented and preliminary project allocations will be determined. By policy, the village encourages citizen participation at all CDBG public hearings and particularly welcomes input of low and moderate income citizens who are intended to be the primary beneficiaries of this program. The village's entitlement grant for program year 21 is not known at this time. However, we may proceed with our typical public hearing schedule. The one-year action plan will not be finalized until the entitlement amount is specified by the U.S. Department of Housing and Urban Development, or HUD. The final entitlement amount will affect the caps for the administrative expenses and public services. And in addition to the new entitlement, we expect to use roughly $50,000 in unobligated funds that we can apply to construction projects. A small amount of program income might be available to impact the public services cap or increase it slightly if we do receive it. Just so you know, side note, the village receives program income when homes previously assisted by our CDBG funded home improvement program are sold within 15 years after the repairs are made. At this time, our overall estimated budget is $650,000. However, proposals from the village and community agencies total over $830,000, so reductions will be necessary. The CDBG program is intended for bricks and mortar projects. Therefore, at least 65% of our budget must be allocated to construction, capital improvement, and rehab projects, as that was the original vision of this program. Based on the village's typical funding distribution of maximizing the 20% administrative cap and the 15% public services cap, public services requests will need to be reduced by more than $55,000, and the construction rehab projects will need to be reduced by more than $127,000. The February budget recommendations will be the result of considering each proposal by the necessity of the work, the requested funding amounts, CDBG eligibility, and HUD's program administration expectations. Village proposals will be presented first, and I will then respond to any questions from the board regarding these proposals. Then agency representatives will be invited to give a brief overview of their funding requests for the coming year with a 2-minute limit. Any new applicants or those who are not current grantees or new applicant representatives of existing grantees are asked to give a brief introduction of their organizations or themselves, in addition to providing a brief overview of their funding requests. So we'll give them an extra minute for 3 minutes. The mayor will call the agencies in the order of the proposals as previously provided in the list. If the board would like to follow along with the PDF of the agenda packet, please note that the overview summary begins on page 17. The village proposals begin on page 25. The public services proposals begin on page 32. And the public facility and construction proposals begin on page 255. Since we alternate presentation order each year, the public services requests will go first, followed by the construction and rehab requests. We do have one organization that submitted a separate construction, rehab, and service application, so they'll provide the transition between these two. And then to move on to the village requests. We'll do this. Okay, so we plan on maximizing our 20% admin cap, or at least preliminarily. We'll use most of it for program administration. We are nearing completion of the assessment of the regional assessment of fair housing. We're budgeting $5,000 for that, just in case the last payout comes after May 1st of this year. The home improvement program, this is a ongoing project, I guess you could say, to repair single-family homes for income-eligible households, and the program began back in 1983. And the request will enable households with less than 80% of the area median income to be eligible to receive grants up to $12,000 to pay for building materials or contractor services. So that request is $90,000. The Affordable Housing Initiative, our more recent project, we'll go into more detail on the concept of this for the current program year at the next meeting on Tuesday, January 19th. But we are looking to budget $100,000 to have that project continue on. The street and alley resurfacing, we're looking to resurface Lamont Avenue between Greenwood and Grosse Pointe, and La Crosse Avenue between Greenwood and Church, which is roughly 0.6 of a mile of street, and the request for that is $220,000. And the village, the sidewalk replacement program is where grants are provided to homeowners meeting income eligibility. And the focus area for this coming year would be any part of the village south of Howard Street. And the request is $3,000 for that. And one more, our social worker position. The Health and Human Services Department is seeking funding to offset 60% of the costs for the social worker position. The social worker works with low and moderate income residents who need various types of case management, financial assistance, counseling, and referrals. And so the request for that is $53,800. So I think I covered all the village requests. Are there any questions before we move on to our organizations?
Trustee Sutker?
Hi, I just wanted to make a statement. I am a licensed clinical social worker employed by a social service agency that is an applicant for a CDBG grant. I do not believe this creates a conflict. However, I believe it is important to avoid the appearance of partiality. Therefore, I will recuse myself from participating in the discussions relating to the applications and from voting on the grants. My recusal from participating in the discussion should not be construed as indifference to the valuable services that the applicants provide to people in need. I respect and admire all of the agencies for their hard work and dedication, especially this year, given the stresses of the pandemic. I would also like to acknowledge the death of a member of the Commission of Family Services and my friend, Angelo Militello. He was a valued member of the Commission, a member of the local area network, and Niles Township Youth Coalition. He worked for 10 years at JCFS, advocating for teens in the alternate suspension program. He will be missed. Thank you.
Okay, what we will do, we will proceed to the presentations. Just to repeat something that Carrie had said, if it is an organization that has been considered before and has received funding, please take 2 minutes. We are familiar with almost all of the organizations. There'll be 16 presentations this evening. If you are new, please take 3 minutes and acquaint us with you. I just want to assure everybody, we have copies, every trustee has a copy of every application that has been made. But one of the reasons for this the structuring of this public hearing is to remind all of us of the valuable work that you do. Much of the work that you do is not in public, it is of a private nature, but that does not mean that it is not an invaluable service to the village. This is a way for all of us to reacquaint each other with what it is that you do, and to thank you for all of the work that you have done in the past and that we know that you will continue to render to the village of Skokie. So we'd like to begin this evening with the category of public services. The first would be JCFS, Jewish Children and Family Services.
Hello, nice to meet all of you. The other thing I want to say, actually, before I say anything else, is your village is so impressive with your COVID readiness. It was just amazing to hear. Anyway, I represent JCFS, and I want to thank all of you for your ongoing generosity and support. We've received dollars since 2014. For fiscal year 22, we're asking for $6,000. We will see 45 to 50 Skokie residents for financial assistance counseling, which could be anything from financial counseling, financial assistance, financial literacy, or benefits assistance. The purpose is to help people understand what led them to their financial crisis, and the money should help them to be at their pre-crisis level of functioning. The other thing I want to say is during COVID, we were lucky to get a tremendous amount of money from the Jewish Federation. So we've been able to really see a whole lot more people. Since April till now, we've saw 72 Skokie residents, and we've been able to give them a lot more money. So we've paid 2 or 3 months of rental or mortgage support, money for transportation, money for food. So, I mean, it's been much easier, and I think it's been more helpful to the residents of Skokie.
Thank you. I can't help but point out that ordinarily this evening would be the coldest day of the year. It seems every time we have this meeting, it's the coldest day of the year, but you look very comfortable this evening.
I'm in my office, so I won't drive home, but I do remember either last year or 2 years ago, it was icy and it was snowy. And so, yes, there's no snow on the ground, so I'll make it home in 10 minutes.
So it's nice to see you comfortable this evening. Welcome. Thank you.
Thank you.
Are there any comments or questions? I'm going to ask everybody for their patience with me tonight. I'm not used to chairing a meeting by Zoom with quite this many participants. The next organization is the Center for Enriched Living.
Good evening, everyone. My name is Karen Fay, and I'm the grants manager at the Center for Enriched Living. CEL has been providing social and recreational and employment programming for individuals with intellectual and developmental disabilities for over 50 years. Our physical building is located in Riverwoods, but we also provide programs in area schools, group homes, and our employment program works with local businesses in the community. Prior to COVID, we did have transportation for some of our programs, and one of our pickup locations was the Skokie Swift. We serve youth, adults, seniors, ages 13 to over 80 years old. Last year, we served 450 individuals, and 30 of those were from the village of Skokie. This year, we are requesting funding from the village of Skokie to support our Employment Opportunities Program. There is an 85% unemployment rate for individuals with intellectual and developmental disabilities. We know that employment is a critical component of the community living for most adults, including our members. Work is a mean for self-sufficiency. Individuals can contribute to their communities, build a network of social relationships, and create opportunities for lifelong learning. The employment program assesses members' vocational preferences, work experiences, assists members in job search activities, and provides education and support to the employers. Due to COVID, currently all CL programs are in a virtual format, and this includes our CEL Virtual Career Academy classes. Even during the pandemic, when jobs are challenging, we have been able to find many new placements for quite a few members. And with that, I thank you for having me tonight and for your support of the Center for Enriched Living, and I'd be happy to answer any questions that you might have.
Thank you. Are there any questions? If not, Metropolitan Family Services would be next.
Hello, everyone. My name is Mary Alston. Can you hear me okay?
Can see you.
Yes. Okay, just checking.
Thank you.
My name is Mary Alston. I'm a bilingual therapist at Metropolitan Family Services in Skokie. I've been providing counseling services at Metropolitan for 5 years now, and we are very grateful for the ongoing support that the CDBG grant has provided our organization. We're requesting funding to continue to provide counseling services to low-income residents of Skokie on a sliding fee scale. The clients that we serve that are seeking counseling services pay nothing in our general counseling program through this grant. Our staff is able to provide therapy services in English, in Spanish, and in Assyrian. And again, we are very appreciative of the ongoing support to this grant that this grant has provided our organization and our clients especially. That's about it. So I'm open to any questions. I'm happy to answer anything.
Trustee Bromberg, did you have a question? Did I see your hand up? No? Oh. Thank you.
Thank you so much.
The Impact Behavioral Health Partners.
Hi everyone, good evening. My name is Anna Sack and I am the Employment Program Manager at Impact Behavioral Health Partners. We are based in Evanston and serve the larger North Shore area. We provide housing, clinical, and employment services to adults living with mental illness. We are seeking support for Impact's Employment Services Program, which operates according to the evidence-based and highly effective IPS model of supportive employment. IPS stands for Individualized Placement and Support and was developed as a method of assisting adults who have severe mental illness in finding and maintaining competitive employment of their choosing within the community. The philosophy behind this model is that anyone who wants to work can work. For instance, our program helps participants who have substance use problems, criminal backgrounds, and those who are actively symptomatic. We focus primarily on an individualized job search plan with the participant while working closely with their treatment team of therapists and case managers, providing updates and brainstorming solutions to any potential barriers that they are facing. Our team of employment specialists are highly skilled and trained in developing relationships with employers to find the best suited job for a participant based on their individual preferences. The position we find for participants allows them to utilize their strengths and to be an effective asset for employers in the community. We have demonstrated our commitment to serving the residents of Skokie by partnering with Turning Point for supported employment services. We've had hundreds of success stories with Turning Point clients and are now partnering with Erie Family Health Services, a medical center providing care to underserved patients in Skokie. We currently have 2 staff dedicated to Turning Point and have recently hired an additional employment specialist to work with the Erie Family Health referrals. CDBG funds from Skokie would be used to support the salaries of these 3 employees. Our agency has a strong reputation in the community of providing quality, supported employment services. 60% of participants referred to our program obtain employment far surpassing the national average of 40% for similar programs. Impact has also maintained a job retention rate of 76% among our employed participants despite the challenges of COVID-19. Impact Behavioral Health Partners IPS program transforms individuals' lives to be more independent and self-sufficient within their community. Thanks so much for having me tonight, and I'm happy to answer any questions.
Anna, thank you. It's good to know of your partnership with Turning Point and Erie. Are there any comments or questions? Okay. Peer Services would be next.
Good evening, everyone. My name is Maureen McDonald. I'm the Executive Director at Peer Services. It's lovely to be with you from home and not out in the cold, although I have to say your hearing is always memorable because it's always cold. And so we are your partner in providing substance use treatment and prevention services to low-income individuals from Skokie, and we work through your high schools, also through the youth court with the Skokie Police Department and the courts in Skokie, and really tried to reach everyone in need. We were honored back in May, which feels like a million years ago now, honored to be named the village's partner in public health excellence for our prevention work, and missed the opportunity to see you all in person, but we're very appreciative of your recognition of our efforts on your behalf. We continued during this COVID time providing services virtually through forums like this, both individual and group services. We added open recovery support sessions so people didn't have to be one of our clients. People are having a hard time finding recovery support, or especially early in the epidemic online. We also added some support groups for parents struggling with their teenagers' substance use, and really continue to try to innovate and be as responsive to the community as we can during this time, especially with schools being closed. It's particularly difficult to find the teenagers who are at highest risk right now. So any suggestions or potential new collaborations you might suggest to us, we'd be very open to that, because we want to keep moving forward until we get into the day when things look a little bit more normal again. So your funds, for which we are very grateful, support the clinical supervision of our outpatient adult and teen counselors. That is a service integral to providing high quality services, and there is really no other way to pay for it. So we really appreciate your support of that level of care. It just makes us better at what we do. And we did see some reduction initially as things shut down in the spring, and somewhat more of a return to normal. We still served over 100 Skokie residents last year, and over 80% of our clients are low income. So we really deeply appreciate your support. I'd be happy to take any questions.
Well, Maureen, hopefully at some point this year, we will be able to see you in person. It would be a joy. But congratulations to Peer. It really is a pleasure to work with you. And I know you've worked with our Human Services Department quite a bit, so thank you for everything that you and Peer Services do for the village.
It's our pleasure, and thank you so much. Everybody stay safe.
You too. Children's Advocacy Center is next. Good evening.
Good evening, Mayor. My name is Mark Parr. I'm the Executive Director of the Children's Advocacy Center. Like the other agencies, I'd like to thank the board for the support you've provided for us. The center provides direct services for children who are victims of sexual abuse, severe physical abuse, or victims or witnesses to other crimes. So we work very closely with the Skokie Police Department, with JCFS, and our Cook County State's Attorney's Office during the investigation of those alleged abuses. And then beyond that, we provide ongoing support, crisis intervention, court advocacy, and individual and family therapy for the children and families. All of that is offered free of charge, and we're able to do that partially because of the support that we receive from communities like Skokie. Last year, we served 38 children. We were anticipating serving slightly more. We did see a little bit of a drop in referrals after the stay-at-home order and the schools going to remote learning, but we have seen referrals pick up again almost to our pre-pandemic levels. We are a 24-hour day agency, and for our coordinated investigations, we have continued throughout this time to provide those in person, wearing masks, keeping distance, and trying to be as safe as possible while we're interviewing the children who may themselves have been victims. All our therapy services have gone to a telehealth approach, and for the most part, that's been very successful with the client families that we've been working with. We're asking for support for the child and family advocate who provides those crisis intervention and ongoing support services for children from Skokie. And I'd be happy to answer any other questions about our agency or our services.
Mark, thank you for the difficult work that you do. If there's an example of an organization that does difficult and traumatic work, but does it privately, it's certainly CAC. We are aware of the tough work that you do, and thank you very much. We appreciate all that you do, as tough as it is, and especially in these difficult times. Does anybody have any questions? If not, the next organization would be the Harbor.
Good evening. My name is Terry Shevchuk. I'm the Government Grants Manager with the Harbor. First of all, I know that the Village of Skokie has been one of our community partners for many years now, so we certainly do thank you for that. This year, we're requesting funding once again to ensure our agency is a safety net and offset cost of services to Skokie youth. Specifically, this would provide support for partial salaries for a therapeutic case manager, as well as an intake coordinator to provide both outreach and intake services to youth. As you may know, the Harbor provides emergency shelter, transitional housing, and supportive services to homeless youth in the north and northwest suburbs. This coming year, we'll be celebrating our 50th anniversary, and we continue to evolve our programs to meet the changing needs of youth. The challenges of this year certainly have not been anticipated, but we're proud to report that we've continued uninterrupted services and have adapted our efforts to ensure the health and well-being of both youth and staff. To achieve this end, we are providing PPE and health and wellness supplies to youth, and we've hired Cintas to provide hospital-grade cleaning and disinfection of our sites. One of the challenges that we have had is that we can no longer conduct outreach in the same way that we had been before the pandemic. Previously, this consisted of a lot of presentations to large groups and most notably referrals from schools. With many schools still being remote, we've been receiving less referrals from schools as it's more difficult for teachers and school social workers to identify at-risk youth without that in-person interaction. To ensure that we're still reaching youth, we have launched Harbor Connect, a mobile outreach unit designed to distribute basic necessities and act as an entry point to our more intensive services. As many youth have lost employment due to the pandemic, we've increased rent support to youth in their own apartments. And to address mental health needs, our therapist has provided therapeutic Zoom groups. We are excited to announce that we were recently awarded funding from the Department of Justice to launch a transitional housing site for youth victims of human trafficking, and we're currently working towards launching this program. As approximately 1 in 3 youth entering our care have had some level of human trafficking victimization, this program is greatly needed to provide targeted trauma-informed services to this population. We have also recently added a congregate care transitional living site for pregnant and parenting youth in Skokie. Previously, our services to pregnant and parenting youth were limited to youth living in their own apartments, where we would provide a declining rent subsidy. So this is a big step towards truly meeting youth where they are on their path to self-sufficiency. We're really grateful to our community partners, like the Village of Skokie, that allow us to continue providing these critical services. We thank you again for your partnership and the opportunity to apply again.
Terry, thank you. Congratulations on the 50th anniversary and the DOJ grant. It's always been an impressive organization to work with. Does anybody have any comments or questions? If not, the North Shore Senior Center.
Hello, everyone. My name is Kathy Honeywell. I'm the Director of Senior and Family Services at North Shore Senior Center. And on behalf of North Shore Senior Center, I'd like to thank you for your continued support of the programs administered in the Senior and Family Services Department at North Shore Senior Center. Your support helps our continued services to low-income seniors residing in Skokie who need help accessing social services and other programs. The Senior and Family Services Department at North Shore Senior Center has served in fiscal year 20, which our fiscal year is July 1 to June 30th. And in fiscal year 20, the Senior and Family Services Department served 22,212 people, and 2,750 of those people were Skokie residents. Prior to the pandemic, the majority of our work took place in clients' homes. We would visit clients, we would help assess their needs, complete a comprehensive assessment, and within that assessment, we would create a plan and offer resources to help meet people's needs. Some of those programs include services such as home-delivered meals, homemaker services, respite, assistance completing entitlement applications, transportation resources. We also supported the social and physical needs of Skokie residents by offering a family caregiver support group at the Village Hall. Since the pandemic, we have changed our way of reaching people. All of our work is telephonic at the moment. We're calling people. We're still completing assessments telephonically. We're communicating with clients on a regular basis, and we continue to connect them to as many services as possible that they're willing to accept in their homes. One new service that we were able, actually it was a grant, we were able to get a grant from the Illinois Department on Aging for the Emergency Senior Services Program, and that program provides services to people who, due to COVID concerns, may not be able to get these needs met, like going to the grocery store and getting incontinence supplies and durable medical equipment and things like that. Since March, we've been able to help 27 unduplicated Skokie residents with those additional funds from the state. Our goal is to help Skokie seniors have a better quality of life by remaining in their homes and aging in place as long as they choose to remain in their homes. And we couldn't do that without your support. So thank you very much. And do you have any questions?
Thank you, Kathy. Other comments or questions? If not, Youth and Opportunity United, otherwise known as YOU.
Good evening, and thanks for giving me an opportunity to speak to you this evening. My name is Craig Wrench, and I'm the Chief Executive Officer at Youth and Opportunity United. Youth and Opportunity United is a YOU respectfully requests $10,000 from the Village of Skokie's Community Development Block Grant in continued support of our out-of-school time programming. YOU will serve 250 Skokie youth at 3 of the community's highest need Title I designated schools: Edison Elementary, Lincoln Junior High, and Old Orchard Junior High. The majority of youth served are low income, with a significant portion being English language learners, including approximately 35% at Edison. YOU provides holistic, trauma-informed, relationship-based after-school and summer programming in schools at no cost to families. Our programs build academic success, foster social emotional development, and provide enrichment opportunities. We see our youth maintain and improve their academic performance and meet Illinois social emotional standards. Like most organizations, YOU has continued all programs and services to youth and families throughout the pandemic. We transitioned to virtual models of delivery, expanded case management and counseling services, and increased individualized academic support. CDBG funding will specifically support youth development workers who will serve as both activity coordinators and life skill mentors. We are really grateful for Skokie's CDBG support of YOU since we introduced programming at our first Skokie site here in 2013, and we thank you for your consideration of this request.
Greg, thank you. We appreciate our partnership with YOU, and it's hard to believe that it was 7 years ago that we began it. Seems like yesterday. Are there any comments or questions? I believe, Craig, you're in District 69 and 68. Is that correct?
Yes, that's correct.
Okay. Yep, keep up the good work. Thank you. Under Public Services Construction Rehab, the next organization would be Asian Human Services.
Hi, good evening, everyone. Happy New Year. My name is Mohammed Paracha. I'm the CEO of AHS Family Health Center. Thank you, Mayor Van Dusen and Board of Trustees of the Village of Skokie for giving me this opportunity to present our proposals. And thank you also, Carrie, for inviting me to this meeting. We applied for, first of all, a little bit about my agency. We are a federally qualified health center. We operate 4 federally qualified health center clinics in Chicago area. 2 of them are located in Chicago. 1 is in Village of Skokie and 1 is in Village of Niles. Through our Skokie clinic, actually, Skokie clinic is one of our 2 sites which is providing COVID-19 testing and contact tracing to the Skokie resident. Annually, we serve about 2,000 Skokie residents, more than 2,000 Skokie residents, but through our 4 clinics, we serve about 15,000 patients. A year ago, we provided 58,000 encounters through our 4 clinics. So regarding our 2 proposals, one, the services grant is basically a continuation of the grant that we received from CDBG last year, and we are very thankful to that. For that, we would be subsidizing partial salary of our dental clinic staff as we provide integrated oral health, primary care, and behavioral health services through our federally qualified health centers. We would appreciate if we will get this continued funding for this project. Under the capital project, we plan to install 4 ceiling air purifier with ultraviolet light, which will basically be installed in our waiting area in the public area where we have a patient coming in and sit over there, wait for their appointment. Basically, this will improve air circulation and also would, improve work environment for our staff. So both providing safety for our staff and patients. So that this project, for that project, we will be spending about 4,500. We are requesting from the village of Skokie. And lastly, I do want to commend the health department, Skokie Health Department preparedness and response, especially to this pandemic, and especially for staying ahead of the curve in COVID-19 vaccination effort. And the presentation that was done in the beginning of this meeting, it was very informative. So thank you. I will take any question if there are.
Thank you. Are there any comments or questions? Keep up the good work.
Thank you. Good night.
Under the construction and rehab projects, first one would be HODC.
Hi, good evening. My name is Richard Koenig. I'm the Executive Director of Housing Opportunity Development Corporation. We're a nonprofit that develops and manages affordable housing throughout the northern suburbs. Some of you may remember that our original project was in Skokie in 1997, so we have been property owners since then. But what you may not know, and what just happened last month, is we actually became one of Skokie's newest businesses. We just purchased an office building in Skokie on Lincoln Avenue, and so our permanent offices will be housed in Skokie from now on. So we're extremely excited to continue that history with the village. Our request proposal is for some existing properties right now that we own and manage in town. Due to COVID, our tenants have really struggled to pay rent. They're working very, very hard to make sure they keep their rent caught up, but there's not any money left over for extras. So we're asking for some funds to help keep the buildings in good condition, keep the buildings up, and we're working with our tenants to try and get them assistance as much as we can while they're really struggling through this time. So we appreciate all the assistance the village has provided us in past years in order to help continue to provide decent affordable housing to residents in the village. Thank you so much.
Thank you. Congratulations on the new offices. Perhaps
Thank you very
once
much.
we're all able to get together personally, we could come over and take a look at the new offices. Welcome. It's great to have you.
That would be terrific.
Our
Thank you.
newest neighbors. And Richard has done a great job for the village of Skokie in low and moderate income housing, and we appreciate everything that you've done for us, and we look forward to continuing our partnership. Next organization is Turning Point Mental Health Center.
Good evening, everyone. My name is Jennifer Saltz. I'm the Development Director at Turning Point Behavioral Health Care Center, which is a community, outpatient community mental health center serving approximately 1,300 children and adults each year, starting at age 5. And approximately 90% of our clientele is low income. Throughout the COVID-19 crisis, we have continued to provide care and maintained our programs remotely. This year, Turning Point is applying for funding to replace one of our 11 rooftop HVAC units, which control heating and cooling in our Skokie Boulevard facility. With the very much appreciated support of the Skokie CDBG program, we have been gradually upgrading our aging HVAC units over the past several years. This is an ongoing effort, and we hope to continue that process, prioritizing the next unit, which is most in need of replacement. The HVAC upgrades that we've been working on have helped to replace aging units that have been consistently problematic, resulting in repeated repairs, damaging leaks, fluctuating temperatures, poor energy efficiency. Several of the units have experienced hail damage that has undermined efficiency, so all of the new units are being installed with hail guards so as to maximize their lifetimes and better protect them from the weather. We are so very grateful to the Village of Skokie for supporting our work, all of the many activities that take place under our roof, with your generous support of our facility upgrades. So thank you so much, and I'm happy to answer any questions.
Jen, Happy New Year. It's good to see you. It's been a while.
Yes, Happy New Year. Happy New Year to Mayor and trustees and colleagues.
Are there any comments or questions? The next organization is SHORE.
Good evening. Hello. This is Mary Matz. I'm SHORE Community Services Senior Philanthropy Officer, so I thank you for the opportunity to speak to you this evening. SHORE has been helping children and adults with intellectual and other developmental disabilities for 70 years as of yesterday. So we're very excited about reaching this milestone, and we look forward to hopefully a fun-filled event year of celebrating that year of accomplishment. And I just want to thank Mayor Van Duzen, the Board of Trustees, as well as the Village of Skokie at large, just for being such great neighbors and being just so welcoming over the last 70 years. Obviously, we've been serving the Skokie community since that time period, with 30 years, just about, I think it's like 38 and a half, of having facilities in Skokie. So we do have a number of residential homes. There's 103 Skokie residents that were served last year. And I'll get into specific numbers for the program that we're seeking funding for, but just want to thank you on that front. The program site is obviously a building that you guys are very well aware of. That was your former Skokie Police Station. It is now our Lois Lloyd / Administration Center. And over the course of, it'll be 6 years next month that we have physically had our administration center in the building. We've done quite a bit of work on our HVAC units and just trying to upgrade a lot of the mechanics related to that. So our request is really to seek funding to replace 2 variable air volume VAV boxes, if you will. They're dampers that are in the ceilings of the building. And what we've done through support with CDBG funding from Skokie is we've replaced now the entire first floor, and that's where our clients are. On the first floor, we serve roughly about 90 individuals. 99% of them are low income. They have moderate to severe and profound developmental disabilities, and a lot of them are medically fragile. So in terms of keeping the air controlled, that is a #1 priority for us. And so these VAV boxes help obviously with that air temperature control. A lot of them don't work anymore, and that's clearly why that's one big project that we are obviously replacing as funding is available, primarily because there are 32 in the entire building, 16 on each floor. We have funding that's going to replace 2 in the next probably few months, and then we're seeking funding to replace 4 of them with this grant cycle, and replacing the ejector pump in the basement. Basically, that controls water infiltrating into the basement, and one of the pumps, the motor's burnt out. And so we were really living on the edge with just having the backup pump available in case of water backing up into the basement, which is not a pretty sight. So that is pretty much what we're looking to do. The Lois Lloyd Center, just to give you a little bit of background on that particular program, we do provide developmental training at that location. There's roughly about 88 clients. Right now, obviously, numbers are very low with COVID. And obviously, with these vaccinations, we certainly hope to see more return, but we offer self-care, adaptive daily living skills, a lot of community outings. Obviously, that's kind of been on a hold too with COVID, but the obviously idea is to provide enrichment activities as well. So these boxes, as I said, a lot of them don't work. They run on pneumatic controls, and that's one other thing that we have been upgrading with obviously support too. We've gone to a digital control panel, and these boxes have direct digital controls. So ultimately down the road, they're all going to be talking to each other. So then they'll know, okay, you don't need to use the air conditioning unit. You'll just be able to, in some ways, just use the natural air where it can go and recycle its way through, and just be more efficient on running the overall HVAC unit. But I want to thank you all again, and if there's any questions, I'm happy to answer them.
Mary, thank you.
You're welcome.
Sure, great neighbors. And you've done a wonderful job on a former police station, I must say. You've really made it very welcoming, and we wish you the best in the coming year. Keep up the good work. The next organization is CJE Senior Life.
Good evening and Happy New Year, Mayor Van Dusen and trustees. It's good to see you, even in this format. I'm David Etheridge, CJE Senior Life's Director of Affordable Housing. Thank you for your continued support to CJE in so many ways throughout the years. Your continued commitment helps us to provide services to those in need. Council for Jewish Elderly, doing business as CJE Senior Life, is a nationally recognized, diversified, and innovative elder care organization. Our mission is to enhance quality of life and facilitate independence of older adults. We offer programs in life enrichment, supportive housing and resources, healthcare, and research and education. Each year, CJE programs benefit over 20,000 diverse clients and caregivers. Participants reside in Chicago's North Side neighborhoods and north and northwest suburbs. Most clients live close to or below the poverty line and receive free or subsidized services. CJE seeks $15,899 in Skokie Community Development Block Grant funds for the Village Center Boiler Control System project. The funds will be used to improve the boiler heating system's operation at CJE's Village Center subsidized senior apartment building. This is at 5140 Gaylett Street in Skokie. Village Center is a 150-unit independent living apartment building that is home to 180 mostly very low to low income Skokie residents ages 62 and older. Most residents' annual household income is less than $15,000 per year. Village Center is one of the few subsidized senior independent living apartment buildings in Skokie. It has no vacancies and 464 people on its waiting list. With these funds, we plan to procure and install a boiler control system. This site has 2 boilers that can run independently. They were installed in 2016 and are well maintained, but operate in an on-off mode with limited ability to control the temperature in relation to the ambient outdoor temperatures. Also, a technician must manually adjust the wiring to allow one boiler to lead and then the other boiler to lag. Lead lag is important so that boilers can wear and age together. The system will stage the boilers and lead lag, include outdoor sensors that will help modulate their operation, and they'll be internet compatible so maintenance engineers can access the system from their desk, smartphone, or tablet. The system will also have expansion capability and long-term support plans to replace the older air conditioning compressors outside the building in years to come. The boiler control system will be expanded as part of that project. The goals of this project are to improve the boiler's lifespan, performance, and energy efficiency, limit operating costs and maintenance, and enhance the Village Center environment. The project will benefit Skokie Village Center residents and visitors by providing greater consistency and the building's temperature modulation. Clients in CJE's Adult Day Services program who are temporarily housed at Village Center will also benefit with CJE staff who will gain greater control over the heating system. This project is a good fit with the Davis-Bacon Act requirements associated with CDBG funding, as technicians required to perform this level of work already are compensated at that prevailing wage that's required. CJE is sincerely grateful for the Village of Skokie's generous support of our requests in past years. Skokie CDBG awards have funded projects that improve facilities and provided better quality of life for low and moderate income Skokie residents, aligning with Skokie's funding goals, which this project also does. We appreciate your consideration of this request. I'm happy to answer any questions you may have. Thank you.
Thank you, David. Are there any comments or questions? I think as David explained, CJE Senior Life makes an invaluable contribution. Thank you. It's always good to see you.
Thank you.
Search is the next organization. Welcome.
Hello, thank you so much. I'm Corey. I'm the CEO of Search. Nice to see everybody again. I believe most of you know Search is a nonprofit organization that provides comprehensive supports to adults with intellectual disabilities. Search has historically served about 500 people annually and their families as well. We currently operate 29 community-based homes for people with disabilities throughout the city and the suburbs. And the village of Skokie is such a welcoming and wonderful home to 85 of the people we serve at 14 different locations throughout the village. So we are everywhere in your community. During COVID, our amazing dedicated staff have come into every single one of those 14 homes in all of our 29 homes, continuing to serve the people that we serve every day around the clock. And I can't commend the work of our staff, but also everyone who has supported our staff in the village of Skokie in making sure that we can be as safe as possible during this really, really challenging time. We at Search take really great pride in maintaining beautiful and most importantly accessible homes that are well integrated into our community, and the village of Skokie has been an extremely important and generous partner to us for many years in helping to support a lot of the capital projects that are required to continue to make our homes accessible. The state of Illinois does not provide nearly enough, maybe even any funding to support the capital improvements that are needed in our homes on an annual basis. We have been the generous recipient of many CDBG grants through the village of Skokie, and we are so thankful. So for this year, we are respectfully seeking support to install an accessible concrete landing in a backyard and to replace the front concrete driveway at our group home located on Enfield Avenue in Skokie. This home is home to 6 ladies with intellectual disabilities who are all very low income and rely on Search to really meet all of their basic needs daily. So your renewed support of Search will significantly be able to improve the accessibility of that home. This home does serve ladies that are aging, and we really hope that we can keep them in place with their continuing mobility challenges. Many of the women who reside in the home are very long-term residents of Skokie and who have resided in this home specifically for many of them a decade or even 2 decades. So they are long-term recipients of the fantastic generosity of the village of Skokie. So safer concrete walkways obviously allow for easier access to and from the home, but this particular project will also give them greater access to outdoor space, which, as we all know, is something that we are treasuring these days, and being able to be outside as much as possible with family and friends safely. So we also will be the beneficiary of a fully accessible exit route in case of an emergency, which is something that we obviously take very seriously as well. So I very much appreciate the opportunity to present. I know you all are in the home stretch of hearing these presentations, so I will keep it very brief, and I'm happy to answer any questions you have. But thank you so much for your previous support and your consideration this year.
Corey, thank you. Appreciate everything that Search does. It's a really good organization, and you do wonderful work. Thank you.
Thank you so much. You all have a nice night.
You too. Happy New Year.
Happy New Year to all of you.
The final organization this evening is Orchard Village.
Hi there. Thank you so much, and I really appreciate this opportunity to address the group. just as a 30-second, we really have appreciated the Skokie Department of Health. They've been a wonderful partner during this god-awful time. Running group homes for adults with developmental disabilities has been a major challenge, as you can all appreciate, during COVID. And we so much appreciate your help in previous years. This evening, we are asking for help in redoing the kitchen of one of our houses, which is also home to 6 ladies in Skokie. And the kitchen is unfortunately laid out to have the stove right between a wall and a cabinet. So both the wall and the cabinet are singed because there's absolutely no place. If you're taking a pot off, it's not safe, it's not good. So, and you can't just move the walls, so you kind of got to rip the stove out and put it on another wall. We're asking for help for $12,000 to help reposition or relocate the kitchen so it's a far more workable space for these 6 women who live in a house on Lowell Street. On March 2nd, 2022, about 14 months from now, Orchard Village will be celebrating our 50th anniversary. And we are so thrilled with the continued support of the Village of Skokie. We couldn't do it without you. Does anyone have any questions that I might be able to answer?
Marlene, thank you. Thank you for hanging in there. We appreciate it. And I think Marlene touched on something a comment I would like to make. All of you do the very heavy lifting that goes on in this community. We do have people who are in great need, and you supply that need. In this last year, I think the infrastructure that was on display this evening has showed why the village does support all of these organizations. You all do that heavy lifting. In this last year, you've done double heavy lifting. These have been challenging times, but the professionalism of all of you, as displayed this evening in your presentations, I think, really shows why it is that we enjoy the partnership that our Health and Human Services Department has with all of you. And as elected officials, we welcome everything that you do for our community. And thank you ever so much for being with us this evening. Next year, we'll try to provide a little inclement weather for you. We'll try and make it a little colder, make it a little more normal, I guess. But thanks to all of you. And Carrie, did you have any further comment?
No, I'm just thrilled that everyone was able to participate via Zoom. My big concern, so I'm thankful for everyone who has submitted proposals, and we'll see what we can work out for everyone for the next meeting in February.
Carrie, thank you, and thanks to Alex, and thanks to Nick for putting this flawless presentation together. I must say, very impressive. Thank you.
Yes, thank you, Nick and Alex.
The concluding item this evening is citizen comments. John?
Thank you, Mayor.
We have one other item.
Oh.
Wherever you want to put it in.
Okay.
We have a funding transfer request as well. Would you want to do it before citizen comments?
No, go ahead.
Okay.
I'm sorry.
Just real quick, we're looking to address a need and capitalize on an opportunity. As you may be aware, we budgeted $70,000 for our home improvement program for this current year that we're in, and $220,000 for street resurfacing. And fortunately, street resurfacing came in under budget, and there is a need for additional funding in our home improvement program due to more costly projects, and then also spring 2020 storm events leading to unexpected home repairs for our income eligible households. So we're looking to transfer village funds from one line item to another, essentially. So we're looking to transfer $74,036 from our street resurfacing original budget and transfer that to our home improvement program. I don't anticipate on us spending all of that by May 1st, but we'll just carry those funds forward and help residents when needed. So requesting basically a funding transfer of $74,036 from street resurfacing to our home improvement program.
A motion to transfer $74,036 from street resurfacing to the home improvement account. Trustee Roberts, seconded by Trustee Klein. Are there any comments or questions? If not, call the roll, please.
Trustee Roberts.
Aye.
Trustee Sutker.
Aye.
Trustee Ulrich.
Aye.
Trustee Bromberg.
Aye.
Trustee Klein.
Aye.
Trustee Gray Keeler.
Aye.
Mayor Van Dusen.
Aye, the motion passes.
Thank you.
Thank you, Carrie. Great job.
Thank you.
I do have some citizen comments for this evening. The first one is from Emily White, 7940 Keeler. I want to register my opposition to damaging a park to build a parking garage. That will be an eyesore and unfair to the families whose properties will devalue. It will also contribute to locally lower air quality. This is from Lewis Mercer, Skokie trustees. I'm an 8-year Skokie resident that lives on Oakton Street. For the first 4 years my family lived in Skokie. We lived on Louise Street in the neighborhood just south of the proposed site for the Hilton Hotel and adjacent high-rise development. I am very concerned about the way in which the Board of Trustees has acted secretly and swiftly on this development, and am writing to ask that the Hilton Hotel project be suspended until after the pandemic.
Sorry, John, I'm having trouble hearing you. Can you speak just a little louder?
Sure. Is this better? I'm very concerned about the way in which the Board of Trustees has acted secretly and swiftly on this development, and am writing to ask that the Hilton Hotel project be suspended until after the pandemic, at which time your board meetings will be held in public again. A development of this size and nature is too significant for you to act without significant consultation of the public. In particular, my former neighbors in the neighborhood just south of the proposed site should have a chance to voice their opinions, given that high-rise developments, which are not low or moderate income housing in the area, will impact their cost of living significantly. You are elected officials acting in the interest of your citizens, not a rubber stamp committee allowing for any and all corporate interests to do what they will with our village's land. Please pause this project and make more room for public comment and neighborhood input. This is from Kathleen Weiss Borough, 5221 Greenleaf Street. I am writing to you, the Skokie Village Board, out of grave concern for our downtown area and our village as a whole. While no one would disagree that a robust business community benefits us all, we must also be present and aware of the impact new developments may have on our quality of life. With that in mind, I am asking that the Hilton Hotel parking structure and adjacent residential developments be suspended until a time when public meetings and discussion can take place, and the plans, a traffic study, and an environmental impact study can be presented, allowing time for these to be reviewed and commented on by the public. Taxpayers and residents deserve to know and also to have a say in how our village moves forward, and as our elected representatives acting to suspend these developments until we can have the opportunity to see, review, comment, and discuss them openly is the only way that this can happen. The thought of bringing future jobs in tourism and their tax revenue to Skokie certainly has a great appeal, but in making these decisions it is imperative that we be fully cognizant of the overall impact of our community as a whole, and that is something that deserves the benefit of steady, thoughtful discussion and a unified vision of our path forward. This is from Catherine Elias. Hello, I'm voicing my opinion to halt the Hilton deal. We are in a democracy. That means you need to hear our public voice and processes. Due to COVID-19, you have not been able to hold a public process which is anti-American. Skokie is a community of working and middle-class families. If you want to gentrify Skokie, you are not uplifting the values of Skokie, which includes an inclusive community. It is imperative that Skokie follows an environmental process and considers the long-term displacement effects of our residents. Our TIF monies, my and other residents' tax money should support our local businesses and our local residents, not corporations like Hilton. We, the residents of Skokie, deserve a voice in this process and full knowledge in this matter. I demand that you halt any decisions on the Hilton project and related resident projects until there can be an appropriate and safe public process. This is from Darren. Dear Skokie Board of Trustees, while the proposed Hilton Hotel and 8,000 North apartments on Oakton will likely bring a needed boost to the downtown Skokie, I would like to know what steps the trustees are taking to ensure that housing in the area remains affordable for current residents. Are affordable housing developments being planned in addition to the current luxury apartment and hotel projects? Are current local businesses, especially those struggling due to COVID, receiving as much support from the village as incoming businesses? Will the Hilton project be subject to an environmental impact assessment before final approval? This is from Jeremy Lipberg. Dear Village of Skokie, I'm writing to you to try and make sure this Hilton deal doesn't go through. Skokie has been a site of lots of urbanization within the past few years, which has taken away from the charm and liveliness of what it was and can continue to be. Please do not go through with this deal in order to keep Skokie a community and not just another urban area. This is from Maggie Vandermeer. As a Skokie taxpayer and resident of District 69, I am writing to ask you to suspend the Hilton deal, at least until a time after COVID when the much-needed community involvement in the decision is possible. As it stands, this deal threatens much-needed green space in Skokie and includes a plan to build more luxury housing, which directly threatens to displace renters and low-income families in one of Skokie's most affordable neighborhoods. In addition, the proposed TIF district will leach tax dollars away from District 69 schools, further impacting those same families. I do not want my tax dollars put towards subsidizing a hotel or luxury housing. I do not support the Village of Skokie using resident tax dollars to invest in a project that will displace my neighbors. Skokie is very proud of our diversity and loves to claim to welcome everyone, and yet this plan is a slap in the face of lower-income families and renters, many of whom include our much-valued immigrant populations. Skokie does not have any policy in place to protect affordable housing, which is unacceptable. If these hotel and luxury housing projects are to be such a financial boon to Skokie, why do they require subsidies from taxpayers? Surely they should be able to pay for themselves. As a resident in District 69, I'd like to point to our school district, one of the poorest in our township, and the incredible work they've done to protect our diversity by championing equity, reaching out to families despite the many different languages spoken, and truly seeking our community input, all while achieving high academic standards. I'm grateful that our school district has used creativity, ingenuity, thoughtfulness, transparency, and community input to continue to work towards making our schools in District 69 a true reflection of Skokie's claim to welcome diversity and value everyone. I urge you to do the same for the village. Instead of pushing through projects like the Hilton deal with minimal transparency and community engagement, I implore you to do the work to inform the community of these proposals and their implications for all residents and to actively seek out community input. This is our obligation. This is your obligation as our representatives. I am also deeply troubled by the fact that the Hilton deal has also not undergone a thorough sustainability review despite Skokie's sustainability plan. You're responsible for actually putting into action the village's commitment to sustainability, which as of now has been an empty promise. If we have learned nothing else from this pandemic, it is the importance of taking care of each other. We cannot claim to be doing that while threatening to displace cherished neighbors who make our schools and communities so incredibly rich. That wealth, that social capital, if you will, should not be sacrificed on the altar of gentrification. This is a question of ethics on many levels, and most fundamentally, it is a question of our identity as a community. Once again, I ask you to suspend this deal in order to have a broad and much-needed community conversation that includes these issues. I appreciate your desire, this is from John Bellotti, 9248 Keystone. I appreciate your desire to bring life back to Oakton Street, but the new project at the corner of Niles Center Road in Oakton is very overbearing and unsightly, and I'm sure the issue of affordable housing has not even been considered with this new upscale housing. Well, now you are planning another project with upscale housing where Annie's Pancake House has been, and I imagine environmental impact and affordable housing has not been considered again. Please vote against this deal with Hilton until this can be brought to the citizens of Skokie to discuss in more detail and with accountability. Please listen to your citizens of Skokie. Jumbo, my name is Jasmine Sabgala. I am a Skokie resident and taxpayer. I live at 5344 Crane in Skokie. I do not want my tax dollars to be used to fund a project that could displace the most marginalized members of our community, reduce green spaces, or take away funds that could be used to support small local businesses. How can the leaders and citizens of this city claim to value diversity and welcome everyone if they value capital gain more than the lives of the people that could be displaced by another luxury high-rise? I urge the leaders of Skokie to put yourselves in the shoes of the low-income parents that work 40 to 50 hours per week to provide a home for their children in Skokie. Think about the child that could possibly be forced to leave his or her school because their parents can no longer afford the rent in Skokie. Consider the impact that your decision to approve the Hilton plan could have on the residents that need affordable housing. Think about the small business owners that could use help to keep their doors open. Why rush to make a decision during the pandemic without getting feedback from the people that will be most impacted by the Hilton project? Trustees are supposed to listen to all residents and vote on issues that affect the everyday life of all residents. Have you discussed the Hilton project with the renters and lower income community members? Renters and lower income community members matter, and you are responsible for listening to their needs and making decisions that benefit them too. I urge you to contact the most marginalized members of this community and find out how the Hilton project might impact them. Include our most vulnerable residents in this process, as you have included the homeowners and most vocal members of our community. The truth is you all will push out the most at-risk residents if you push the Hilton deal forward. The Skokie welcomes everyone signs are misleading. Your actions speak louder than the words on those signs. Show the community that you welcome and consider the needs of the most marginalized members of our community. Prove that every member of the Skokie community is truly welcome, represented, and safe in Skokie. I have a few suggestions. Hire teachers and police officers that reflect the diversity of our community. Look at the beat cops on page 6 and 7 of the January Skokie New Skokie. What do you notice? Maintain and develop affordable housing in Skokie. 50% of the kids at Lincoln Middle School received free lunch last year. There is a need for affordable housing in Skokie. Many District 69 residents cannot afford higher taxes. Invite the most marginalized members of our community to discussions about decisions that impact them. There is no diversity without inclusion. Rebuild trust with the community, reduce citizen complaints, and add to the village's transparency by buying body cameras for police officers. Thanks for reading my comments and providing proof that you value the most marginalized members of our community. Suspend the Hilton deal until you have scheduled and met with the renters, low-income residents, and District 69 residents that will bear the burden of the Hilton project. To our Board of Trustees and village leadership, this is from James Johnson, 4821 Hull Street. My name is James Johnson. I live on Hull Street near Tecumseh Park, and I'm aligned by the village's support of an 8-story Hilton hotel in my neighborhood. I'm glad the village cares about the small businesses on Oakton, particularly given how much they've struggled in the past year. But I believe the village's redevelopment plan for downtown is outdated. In 2021, we should be rethinking Skokie's long-term goals, not trying to go back to business as usual at whatever cost. The intention of this project may be good, but it will have negative side effects, particularly for environmental sustainability and affordable housing. When talking about environmental sustainability, keep in mind that the village has now officially failed one of the goals of its sustainability plan: to conduct a village-wide greenhouse gas emissions audit by 2021. This is the year we are supposed to finish our first sustainability plan and draft a better one for the future. So it's alarming to watch the village support so many high-impact corporate constructions without consideration of their long-term impact. Skokie's greenhouse gas emissions are mostly from commercial and industrial buildings, and hotels are notoriously wasteful. It saddens me that the remaining green space in the Science and Technology Park is still destined for corporate development, starting with an enormous 7-story parking garage to be built next to the Hilton Hotel. Can we really not envision a better, more sustainable use for this precious green space? I'm also concerned that this hotel clears the way for an adjacent residential development, even though the board has made no mention of what this would be. How are we to know that this will not be another luxury development without any affordable units, like the 8,000 North construction downtown? Affordable housing is so precious in these times, and many residents in the neighborhoods around this project are housing insecure. If the village is supporting another large-scale residential development downtown, what affordable housing ordinances and protections will you put in place to protect affordability? As you can see, I'm aligned by this hotel, but I'm even more concerned by what could come after. The village is still following a downtown redevelopment plan from 2005, from 2 economic crises ago, before the village even had an environmental sustainability plan. After 2020, a year in which all of us have had to rethink our long-term plans, I ask you to do the same. Please suspend the Hilton Hotel project until after COVID, when your meetings will be public again and you can properly engage the community about a new development plan for downtown, one that's more mindful of environmental sustainability and affordable housing. I know this is a huge request, but I ask for you to consider it nonetheless. Thank you. The final one is from Andrea Howland. Please, please, please suspend the Hilton Hotel project until after COVID, when the Board of Trustee meetings will be public again. As a longtime downtown Skokie resident with a daughter attending Niles West High School, I will be significantly impacted by this project, as we have been by the middle school construction across the street. I regularly walk my dog in the STEM park and ride bikes with my daughter there. Already, it is very hazardous to cross Oakton. I've almost been hit by drivers who didn't see me or didn't care. Adding an 8-story hotel will only intensify the downtown congestion. One thing we do not need is more unaffordable luxury housing. It's easy to find these ridiculously expensive apartments in sky-rises no one wants to live in, what I understand to be the second phase of the project. These apartments are easy to find because they're not attractive, and there are several of these going up already. Regarding the parking garage, there is a parking garage next to the STEM park, another one being constructed as part of the luxury apartment complex going up and down the street. Why do we need another parking garage? After 8 years living here, I've never had a problem finding parking. The only problem with parking is the 2-hour limitation. Remove that limitation, install parking meters with longer time slots. Why are we solving non-existent problems with unwanted, expensive solutions that will change the landscape into something undesirable? And I haven't even mentioned the rat issue. That is an actual problem. I've never seen so many live rats in my life, while out driving at night or walking the dog. The influx of residential garbage created by the pandemic and the construction have created a real health hazard. Why don't you focus on solving the problems your residents and parents actually have? Spoiler alert. No one wants to live on Thule or Dempster. The Holiday Inn down the street and the DoubleTree are rarely at capacity. I'm beyond frustrated with the poor governance I've seen over the last few years. You need to start responding to the residents' concerns, not running away and hiding behind closed doors.
Thank you. A motion to adjourn to an executive session is in order. I think it's Trustee Roberts tonight, if I recall correctly.
Be happy to make the motion to adjourn to executive session.
Executive session we go into.